Hi there. So today I'm going to be talking about common nutritional insufficiency and signs and symptoms related to those conditions. And what I want to start off by saying is that this list is not exhaustive, but it is a list of things that I see commonly in my practice and commonly as a result of patients being on the SAD or standard North American diet. So to start, deficiencies in your essential fatty acids or omega-3s. Signs of this that you may be experiencing that you may not know are related to this deficiency are things like dry eyes, depression, issues with cognitive function like brain fog, and dry skin. Moving on, iodine deficiencies. Some signs of deficiency include goiter, which is basically a swelling of the neck at the base of the neck, which is your thyroid swelling up, or hypothyroidism. That being said, please be careful, ladies. I often see patients come in that have said, I was diagnosed with hypothyroidism. I went into the natural health food store. They recommended iodine, and now I feel worse, or perhaps you feel better, but it's a short-lived thing. Iodine is something that is very, very carefully monitored by your body. And so if it is too high or too low, it can throw your thyroid for an absolute loop. So it's something that if you're going to be supplementing has to be done or should be done under medical supervision. The next one I want to talk about is iron. So signs that you are iron deficient include fatigue, hair loss, pale skin, conjunctiva that are pale. So if you pull your eyelid down and look up, sorry if that disturbed anybody, but if it's really pale under there, then you may be iron deficient. Weakness or shortness of breath, poor appetite, a rapid heart rate or heart palpitations, frequent colds and upper respiratory illnesses, and an inability to recover effectively. So if you're one of those people that goes into the office and as soon as somebody even sneezes, 3 cubicles over, you're like, oh, here we go, I'm going to be sick in 2 days, then iron is definitely something that you want to look at. Magnesium. Magnesium is deficient in most women that I see when it is tested. So this is a deficiency that I see often in clinical practice. It manifests as leg cramps and other muscle cramps, but often that twitching that you get at night is a result of a magnesium deficiency. Eye or facial twitching, constipation, rapid or irregular heartbeat, elevated blood sugars, and sleep disturbances. So this is a major one, and I do suggest that you again talk to a naturopathic doctor or your medical doctor about what is the best source of magnesium for you. I will try to do another video on that, but as you may have seen, if you've ever gone to a health food store, there are many types of magnesium, all of which are beneficial for treating different types of magnesium deficiency. The next one I want to talk about is vitamin B12. So this is one that needs to be supplemented often when you are supplementing iron as well, because it helps with absorption, as well as your vitamin C if you were supplementing iron. So if your B12 is deficient, you may see signs of fatigue, weakness, constipation, loss of appetite, numbness or tingling in your extremities, hands and feet, difficulty maintaining your balance. It can manifest as depression or poor memory, and soreness of the mouth and tongue, which is a little bit of an odd one, but that can be a sign of B12 deficiency. Next is vitamin D. I see this all the time, especially those of us who are living up north. It can manifest as depression or seasonal affective disorder. Hashimoto's thyroiditis is something that often requires a vitamin D supplement. Elevated blood sugars, diabetes, obesity, bone pain. Sometimes in children I see this, and muscle weakness can indicate that you have inadequate vitamin D levels as well. And like I said, it's common in many people, especially here up north. And then the last one I'm going to discuss today is zinc. So if you are getting frequent colds and flus and upper respiratory infections, if you have white spots on your fingernails, that's a sign of zinc deficiency. And if you have a loss of taste or smell, this is something that you really have to compare to other people. So just because it can be slight, so something that you may not pick up on your own because it's just something that develops over time. But I would suggest that if you are going out to eat, somebody is saying, wow, this tastes so much like X or Y, and you're like, I'm not getting that your zinc levels are something that you may want to look at. And one of the other major ones is delayed wound healing. So if you find that you're getting a bump or scratch, scrape, and it is just not healing for you, then zinc is definitely something that you want to look at and make sure that you are not deficient in. I'm going to leave it there for today. If you have any comments or questions, please post them below in the comments, and I will do my best to answer them in a timely manner. Take care. Have a great day. Bye.